Hello and welcome. We are at Einstein ASCO Booth 2025 annual meeting in Chicago. We are honored to speak with experts who reshape the way we approach cancer care. Our topic today is patient-centered care, a model that combines scientific precision, human connection, and technology to offer more effective and humane treatment. Welcome, everyone. I'm Ludmila Koch, clinical oncologist at Hospital Albert Einstein. My focus on lung cancer, head and neck, neuro-oncology, and my passion is geriatric oncology. Here, I'm with my friend Ana Paula Cardoso, clinical oncologist at Hospital Albert Einstein. Her focus is on uro-oncology, and she is a LACOG member. And now, Dr. Petros Grivas, I'm happy that you accepted our kindly invitation. He is Clinical Director, Genitourinary Cancers Program, Fred Hutchinson Cancer, Professor Clinical Research Division, Fred Hutch, and Professor Division of Hematology and Oncology at University of Washington School of Medicine. Now we are talking, the first segment is individualized treatments and precision oncology. Let's begin with you, Dr. Petros. How has precision oncology changed the way we treat cancer, and what progress have we seen in tailoring treatments?
Thank you so much. Obrigado for the kind introduction and the great program you're having. It's very exciting to be here at ASCO, and it's so exciting to see the progress in the field because traditionally we have a one-size-fits-all approach, but now we're moving to, as you said, a more personalized approach, and precision oncology, I think, is a great way to try to have more precise mechanisms in terms of understanding the tumor biology, but also tailoring treatments based on particular genomic mutations that the patient tumor may have. Just to give you a few examples of that, progress in the field, I'll focus on urinary tract cancers for those examples. In prostate cancer, we have seen progress with PARP inhibitors, molecules that are targeting particular mechanism in the cell that are very effective in patients who have tumors that harbor mutations in the DNA repair mechanism, DNA damage response, DNA repair, DDR mutations. And we have drugs that have now been approved in the United States and other countries for those DDR mutated prostate cancers. Another example is in metastatic urothelial carcinoma, for example, metastatic bladder cancer, when we have a drug that is targeting mutations or fusions rearrangements in a molecule called FGFR3, which is in the membrane of the urothelial carcinoma cells. If there are mutations in that gene, that is driving signaling in the cancer cells, cell proliferation. So that drug called erdafitinib is targeting those mutations in that particular setting and has also an FDA approval in the United States for metastatic urothelial carcinoma. Of course, there are many other examples in lung cancer and many other cancers where we try to understand better the genomic landscape, the mutations that the cancer has, and try to have medications, drugs that can target those mutations as precise as possible. We have to do more work in the field to develop more therapy targets and more biomarkers for better therapy selection. We have way to go. We have made huge progress so far. We celebrate the progress and we're optimistic for the future because we still have a lot of work to do for more optimal precision oncology therapeutic applications and patient selection.
Okay, and how does this personalization align with patients' values and life goals?
Absolutely. I think you raise a great point. And we were discussing together, a few days ago with Ana Paula about the importance of patient-centered care, right? And it's important to ask the patient for their wishes, their beliefs, their expectations, and what their goals are. Because as medical oncologists, we have, of course, the priority to help the patient, but we need to hear from the patient what their goals are. That may not necessarily be what we have in mind. So that plays a big role in the therapeutic relationship and also in the selection of appropriate therapies, because personalization is not only about precision oncology and therapeutic targeting. It's adjusting to the patient's wishes and beliefs and expectations and goals. So for example, I always ask the patients in the first appointment, what's your more important goal? Is it to prolong your life? Is longer life? Is it we try to cure the cancer? Is quality of life very important? So you find these, important information points, data points to help your decision making. For example, toxicity and side effects of treatment compared to potential anticipated benefit, overall survival, progression-free survival, response rate, efficacy endpoints in trials, and quality of life, toxicity, side effect endpoints. So those balances have to be, taken into account based on what the patient wants. So it's a discussion with the patient and establishment of therapeutic relationship, utilizing technology, but also taking the patient's beliefs and goals into account.
Perfect. And Ana Paula, think about the patient-centered care and the role of the multidisciplinary team. When we talk about patient-centered care, we are talking about listening, respecting autonomy, prioritizing the person behind the diagnosis. How does this shift impact clinical routines?
This is very important what we were saying, because putting the patient at the center is key. So we've seen at this meeting, ASCO, every year more patients collaborating with this discussion, so bringing necessity to our goals. So when an oncologist discusses effectiveness of treatment, we are always saying about overall survival, progression-free survival, overall response rate. And it's not that this is not important, but when the patient is at the table, he brings the question, what about quality of life? I want to live other than cure my cancer. So I think this is a game changer, and it's our responsibility to share information with the patient, so you give power to the patient. And when the patient has this power, he has a real duty of his to have a real informed decision making is his responsibility, and we share this responsibility. At the same time, we have this opportunity to discuss a case 3 days ago in a very big Latin American meeting. And I share a case of a patient of mine. It's a 78 years old lady with a very aggressive cancer. And I discuss her goals for the treatment. Want you to have a very efficacious treatment, and if we decide for the best one for you, you may have some toxicity. And she wanted to take the chance because she wanted to plan the trip with her daughter at the end of the year. And after a very tough journey, she's free, she's cancer-free right now. So this is something about our task, about our responsibility to share this information with the patient, to give power to this patient. And this is also the beauty of our task. And I think this is the best part of our work.
Very well said. Yeah, very well said.
And what role do multidisciplinary teams truly in delivery patient-centered care?
I think this is also very collaborative. We don't do anything alone. We are always collaborating with the nurses, with the physiotherapist, with the labs, with everybody. Everybody has to work together. And also, when you talk about multidisciplinary tumor boards that we have every day for more than 2 tumors every day, we do, and we discuss all the cases, and we share the decision process with another doctors. And this is essential, I think, for everybody. At the end, the patient, it's the best, the one that we want to achieve.
Absolutely, I fully agree with you. And It's so important to have these multidisciplinary panels whenever and wherever possible, to have this informed decision making, having opinions from a urologist, a medical oncologist, a radiation oncologist, have a pathologist with expertise, a radiologist to look at the imaging, the scans. All those disciplines come together to try to inform the therapeutic plan for the patient. And of course, as we discussed before together, we take into account the patient wishes and goals, so it can be a personalized treatment plan, taking into account all the information from the expert in the multi and interdisciplinary manner through collaboration, mutual exchange of knowledge, gathering data from the literature, and try to apply this data to the particular patient in front of us.
And change the topic. The rule now is about technology, AI, and integrated health records. Dr. Petrus, how do technology and AI enhance patient-centered care in practice? And are they really making a difference?
It's a great question. We're so excited about technology advances. And one of the themes here from the ASCO president was about how to use technology, engage the community, do advocacy to move forward and improve patient outcomes. And technology is a big pillar in that approach. And there are many potential applications of novel technological advances that we're now using in clinical practice. And I think in the future, we're going to use even more. For example, we have all this discussion with our pathologists about digital images of the pathology slides, so we can have access to them and have pathology experts, maybe in a remote center, to have access to these digitalized pathology images, scanned images, to look at the pathology and help inform the pathologic diagnosis for a patient that can have implications in the treatment plan. Another potential application of technology, for example, AI, artificial intelligence in the future, is to try to use imaging and pathology to help inform the development of putative biomarkers that can help us in the future, upon further validation, select patients for the right treatment, going back to what we discussed together before about personalized approach. So I think the future is bright with the development of technology and appropriate use of tools. We can enable, facilitate better patient selection for particular therapies. And of course, the other big question is in the future, can we use artificial intelligence or augmented intelligence to help us with therapy decision making? And can we, let's say, scan all the data in the literature, because, our human mind has some limitations, right? You cannot read 5,000 papers a day to be up to date, but AI can help us, do that scanning of literature and give us some current state-of-the-art evidence-based approach, and the physician, the provider, can make decisions based on this help of that tool, and of course adjust this data based on the patient's wishes that we discussed before. So I'm very excited about the current, but also the future potential technology applications. We still have a lot to learn. I think that augmented in artificial intelligence cannot replace humans, but humans can deliver even better care utilizing technology and AI.
I think it's a lot to learn, but I think that there's more benefit than malefits. Artificial intelligence can help us bring all this information together, and even for the patient, maybe to inform better than Google. It's something that is working for them to bring the information more correct. And if the patient has more information, then it can help us to take the best decision. So I think it's a lot to learn, but I think can help us. And even about technology, other technologies that can help us, one of our worries is about how to take this technology to Brazil. So sometimes we don't have that much money to bring ctDNA or to do molecular tests for everybody. We cannot do this for everybody. So I think in the future, this will help us to expand the access to the patients.
It's a great point, have more access, because access to care is a major point, and relevant to your great question, how can we improve access, especially in remote areas, rural areas, even within the United States, Brazil, in different countries, and hopefully technology can help us much better in the future in terms of access to care.
To close, I would like to ask each of you to share one key message And how do you move toward truly patient-centered cancer care?
I will let Ana Paula go first. The ladies go first.
I was expecting for you to go. So I think that the big message is that we have a lot to work. We have to work with this information to come and bring the technology, to help the patients to understand everything, and to be always in the topic, to know everything, and to bring the best treatment for our patient.
Absolutely, I agree. Very well said. I think, the key take-home message here is that, it's a team approach. It takes a village, as we say in the US, and takes the whole team to do very important patient-centered approach for patient care. As you said, the patient is in the center. The research we're doing in clinical trials, in the laboratory, in the translational research is patient-centered. The ultimate result, ideally, will be to improve patient outcomes and help patients live longer and live better. We have made huge progress in the field, especially in the last decade. It's amazing progress, much better patient outcomes. Patients live longer, more patients are cured, but we're not done. We have so much way to go in the future, so much work to do. I think we're living in a global era. I think international collaborations, international research collaboration, patient care collaborations are very important. Technology will help us as innovation and tools that technology can provide, like AI and others, to help us achieve that goal of better patient outcomes and more precision oncology, but also personalized approach overall across in medicine.
Okay, I think humanization is above technical and ethical commitment, and technology is not a substitute for empathy, but a partner in delivering it. Thank you all for this rich and inspiring conversation. It's clear that patient-centered care is not just a philosophy, it's a practice that brings together innovation, compassion, and dignity at every stage of cancer care.
Absolutely.
Thank you.
Obrigado.